So just wanted to show you that this was the lesion, and this is the patient, and this patient had a symptom of pain radiating towards the ear, and patient is not able to swallow properly, and the movements of the tongue are also restricted, you can see. Okay, he is not able to move his tongue properly. So this is how you can examine the tongue. Hold the tongue from the tip with the gauze in your hand and ask the patient to loosen the tongue, and then you can, with the gloved hand, you can hold the tongue with one hand, and with the other hand you can palpate the whole lesion. You can see that this is a small leukoplechic type of lesion also in the floor of the mouth. This can be a pre-malignant lesion along with the malignant lesion here on the tongue, or it may be an extension of this lesion due to field cancerization into the floor of the mouth. So you need to be very, very vigilant when you see these patients clinically. So why I wanted to show you this thing, because it is very important to ask for MRI when you see a lesion in the tongue, as we were mentioning earlier as well. If you see on the MRI gives you a lot of information in this case. So in this case, lot of information with the MRI. This is the central part of the tongue, and this is also the central part of the tongue. But at one point of time, the lesion is extending up to the central part, that is the midline septum. Okay, here, this is the midline septum, which you cannot see clinically. So that is the reason why a lot of inflammation with the below the ulcer, as well as infiltration of the cancer cells into the intrinsic muscle of the tongue. And when it reaches up to the midline, it is very difficult for the patient to move the tongue. Okay, and as every one of us know that the cauda tympani nerve, it joins with the lingual nerve, and the pain sensation from the tongue is radiated towards the ear. So that is a classical sign of infiltrated tongue tumor, which is infiltrative into the tongue, and patient develops pain in the left side of the ear, wherever is the